Welcome to another of METV's programs on legal topics of interest to our viewers. I'm Senior Judge Lee Haworth. Today we will address one of the most pervasive problems our society faces, the problem of how to deal humanely with those with the most severe mental illnesses. We've all seen them. They may be walking downtown, staring blankly, spaced out, mumbling to themselves, disheveled and dirty. They may look crazy and scary. Sometimes they pose threats to persons and property. They may blight an otherwise attractive tourist, commercial, or residential area. How are the most seriously mentally ill people treated in our courts and in our community? We'll attempt to answer those questions today. Now, we have with us a judge who will address how the legal system attempts to manage the problem. We also have on the panel an experienced clinical psychologist who has evaluated and treated this challenging demographic. And we'll hear from an entrepreneur who works to provide innovative approaches that can make the lives of these troubled citizens easier and productive. So, let me introduce the panel. First, we have Judge Erica Quartermain. As a Sarasota County judge, she deals often with the seriously mentally ill. She's required to know and follow the rules that say how the courts deal with this population. The jurisdiction of her court exposes her to the types of crimes most likely to be committed by the seriously mentally ill. And working with community stakeholders, she's found an innovative approach to the problem with the Comprehensive Treatment Court, which she conceived and implemented in Sarasota County. Next, we have Dr. Eddie Renier. He is a clinical psychologist with over 30 years' experience. He's evaluated and treated many patients suffering from the most profound psychoses and debilitating mental diseases. He'll give us insight into what's going on in their minds, what makes them the way they are, and he'll offer some suggestions as to how they should be confronted and treated. Finally, we have J. Scott Eller. He is CEO of Community Assisted Supported Living, or also known as Castle, Inc. His organization provides various levels of care that meet the needs of a diverse population of residents, many of whom suffer from serious mental issues. These levels of care include assisted living facilities, independent housing, family-style homes, and live-in support. He has residential facilities in Manatee, Sarasota, and in several other counties. He offers an innovative approach to managing the most difficult people in our communities. So, Judge Quartermain, when you see a person in court, and it's obviously they have some mental disability, what symptoms suggest to you that they have a mental illness? What are you looking for?
Well, in most cases, it's not apparent by merely looking at the person. Homelessness is a major indication of mental illness. That's something that the federal government has studied through various grants and programs, and that is a #1 indicator of mental illness. So certainly when you see someone who appears to be homeless, you know, they're not clean and their hair is raggedy and their skin is affected by the elements outside, that is definitely one clear indication. But many times you don't know.
Do you get paperwork that helps explain their history and background?
We do in some circumstances. If they have been put in jail, the jail has people who speak with them to determine what their background is, but they can decline to speak with those folks as well. So oftentimes you have information that is helpful, like a criminal history and where they're living if they are describing themselves as homeless or mentally ill, but oftentimes it's not a lot of information.
When you look at the criminal history of some of these folks, can you tell me some examples of how many misdemeanors they may have had by the time you see them at these first appearances?
Sure. Of course, the people we see at first appearances, as you know, I mean, there are up to 50 a day, sometimes more.
First appearances are the first hearing after they've been arrested. The ones that don't bond out go in front of a judge.
Right, exactly. But some of the worst cases I've seen where people have been suffering in an untreated way from mental illness for years, also experience a co-occurring substance abuse disorder and homelessness, they can have over 100 convictions for misdemeanor offenses and have spent, 3/4 of their year in custody because they're going in and out and in and out. So it can be quite substantial. And then there are people who are there on their first offense because there has been an episode where they have either the diagnosis is just recently onset and they don't understand what's happening to them, or the illness is onset, or they've been fine and just are unstable for some purpose. I will also note the jail does do a screening for mental illness at the booking stage, and that is using a peer-reviewed empirical data-based form that will let a medical professional know if someone is likely to be suffering from mental illness. But again, we have to remember we are in the constraints of a fast-moving environment, which is booking, and mental illnesses are complex, and it is an imperfect system, but we are doing the best we can.
So give examples of the types of crimes that these people commit that you see most often. Are they violent crimes, nonviolent? What are we talking about here?
Well, when we're talking about the people who are severely mentally ill and incompetent, what we are seeing is homeless type crimes. That's what we would call it in the legal community. So it would be trespass at a business, or at an open container charge. Lodging is a charge that has been used over the years.
Shoplifting too.
Certainly. Petty theft, frequently it is food, but it is also alcohol sometimes too.
So why don't we just lock these people up?
Well, that's what we did for a long time. And what we saw was the effects of that. And the major effect is the suffering of the individual, because that person remains in a state where they are untreated. In many cases, it's schizophrenia or bipolar. I would say almost 70% of the people that I see fall into that category. So there are medications available. They could be better. There is a lot of hope for these people, but they remain in a pattern of bouncing between crisis stabilization units like the Baker Act facility or Marchman Act facility and the jail and the street. So also locking them up is very expensive, and it is much better to provide a holistic approach to make it more cost-effective and humane.
So what rules of court constrain your discretion in this area? What is it you're allowed to do? Are the rules that say this is the way you treat a person who has an obvious mental illness? What kind of hospitalization? You mentioned a Baker Act. What is the Baker Act?
Well, the Baker Act is outside of the criminal system. It is a proceeding in which an individual has been deemed by either a law enforcement officer or a medical or mental health professional or even a family member to demonstrate some behavior that leads the reporting person to believe that the individual is either an imminent threat to themselves or someone else. So typically that's homicidal or suicidal. It's a high level of danger. So then outside of the criminal system, so before anything criminal in nature has actually happened ideally, then a crisis stabilization unit like the Baker Act facility run by Coastal here evaluates those individuals. It's an involuntary evaluation.
It's a hospitalization considered, right?
Yes.
I mean, that's what we're talking about.
Right. So then involuntary inpatient treatment could be ordered if an individual is not willing to do it themselves and they meet the criteria. Also, involuntary outpatient treatment is available as well to basically coerce that individual to get the treatment that is required. So alternatively, the individual could voluntarily stay in treatment, and if the criteria is not met and they do not wish to be there, then they walk out the front door.
Well, one of the things that I've noticed is that when a person is committed to the Baker Act, particularly if they're indigent, which a large percentage of them are, they keep them for a couple of days, maybe 72 hours, stabilize them, give them medications, and then they're released. Dr. Rainey, I know you were instrumental in the FACT team organization at the beginning. How do you see that system working?
Well, at this time, I don't think the system is working. And it fails for a number of reasons. The severity of mental disorder and the inability of people with resources to meet that need. 72 hours is not long enough to stabilize somebody, particularly the medications take sometimes 3 weeks, 4 weeks to take effect. Taking the person away from an obnoxious situation often is the beginning to stabilize them, to give them something to eat, to be in a safe environment. But that can't be done in 72 hours. So there's problems. Here's another problem. The person could be violently ill and show a little decrease in their level of violence. And what happens is they're deemed to not meet Baker Act criteria anymore, and they're released. And within minutes after being released, they could then become very dangerous and could harm somebody. And so I think there needs to be fundamental changes in the Baker Act law. How long someone is kept, talking with the Baker Acting person, because many mental patients can present as calm for a few minutes, even an hour. But a day before, they may have been terrorists in the community. And the person who's talking to them for that hour may think there's nothing wrong with this person, because they maintain control for an hour. But if they waited a second hour, they may see what the Baker Acting person saw. So there are problems. A Baker Acting facility, a receiving facility, should probably be in touch with whoever the Baker Acting person was.
Well, of course, in order to extend the stay, there has to be funding for that. And where does Florida rank when it comes to helping the mentally ill, Doctor?
Florida has consistently, over the last 10 years, ranked the lowest of all the states. In fact, there's only 2 areas in the United States that's worse than Florida. That's Guam and Puerto Rico. We are at the bottom of the barrel in terms of resources for mental disorder.
What are the nature of the psychoses or mental illnesses that you see most commonly when people are admitted for Baker Acts that are coming from the court system?
As Judge Quatermain said, mostly we see people who are severely mentally ill, people with severe bipolar disorder. That is someone who is manic, who believes, who is happy and believes the rules don't apply to them, and often very quick to be irritable and to fight, and they're often angry if their desires are questioned in any way, even the smallest way. The other group is the schizophrenics who suffer from delusions, who can't trust their sensory organs. Our brain makes decisions based upon what we see, what we hear, what we feel, what we taste. And if those sense organs are given misinformation, then that person is in terrible strait. They can't communicate, they're scared, they're often anxious, they're worried, and potentially violent in that state. And so when we meet people like this, those are the people who get arrested. They get arrested because they're out of control, they're doing something extreme. And they don't stop it when they get arrested. They fight the officers frequently. When they get to the jail, they often won't eat. They continue to fight. They won't stop. They almost have superhuman strength. They don't tire. And so frequently the jail has no choice but to lock them in a small room with a metal door with a little slot for them to see out of. And there's nothing to do but to wait till they exhaust themselves, till they calm down.
So, Judge Quatermain, when you see a person that has this apparent mental disability, how do you go about getting them evaluated and have a medical determination that they actually are incompetent?
There are a lot of players within the criminal system, and I believe everyone has an obligation to keep their eyes open and their ears open to see if someone might be in need of services or is potentially incompetent. So while I observe it in some circumstances, it is often the defense attorney who will bring forth a suggestion of incompetency or a motion to appoint experts to determine competency. So if there is a good faith reason to believe that, and there always is, then I would appoint an expert to evaluate the defendant, an expert like Dr. Renier, for example, with his type of qualifications. And there is a number of factors that are listed in the criminal rules that the doctors are supposed to take into consideration and report on. Then I determine, based upon that report or reports, and potentially live testimony from the experts, if that person is going to be competent to proceed or incompetent to proceed in trial.
And this is different from determining sanity in the legal sense, whether the person's insane for having committed the offense. You're talking now about assessing their capability to respond to their surroundings, to know what a lawyer is, what a court proceeding is, what the charges are. And Dr. Renier, you've probably had to go see these people in a jail. Is that something you've had to do in the past?
Frequently. And some of them are able to talk. Some of them, once they're isolated from an environment they're fed, they calm down, they can communicate. Some of them cannot. Even sometime a month later, are still bellicose and angry and hostile. And sometimes, frankly, dangerous to the doctor who goes to see them. What we have is help from the officers in the jail and these receiving facilities, wonderful people who warn us ahead of time. But what we're looking for is, can they communicate? Can they understand that they're even in a jail, that they've committed a crime? Can they understand they have a lawyer, if they have certain rights? Do they rationally understand what those rights are? Can they participate in their defense? And if the answer to these questions is yes, then they're competent. And frequently, unfortunately, the answer is no. They don't understand this.
Well, let's take an example of one who flunks, basically, and is determined by the expert, and the judge agrees that this person is incompetent to proceed. What do you do with them?
If they are deemed incompetent, can
they stay in jail?
Well, in the felony cases, it's different than the misdemeanor cases. So let's talk about the felonies first. And the Florida statute 918 provides a process where they will be committed to the Department of Children and Families for purposes of competency restoration. And that means they will go to the state hospital. So in a sense, they remain committed, but they are in a state hospital setting if and until they can be restored. If they cannot be restored, that's an issue that is brought before the court, and the case will proceed with potentially a dismissal, or they will remain in custody or in the state hospital indefinitely. Now, in misdemeanors, historically, we have never been able to utilize the resources that were funded through 918 of the Florida statute. So when an individual was deemed incompetent, the court put those folks on a competency docket. And if there was no reason to believe that competency would be restored, the case would be dismissed after a year. And it would be up to the state attorney to bring forth some evidence to indicate that indeed competency had been restored, and that never happened. So once an individual in the misdemeanor case was deemed incompetent, basically their cases would get dismissed.
So they go out and do the same thing again?
And they would have to be released from jail, because while it was possible to place them on something we call conditional release, which means we're going to let you out of jail, but there are conditions you are going to have to follow, in order to have done that, we would have had the resources in the community for that purpose. So because the resources did not exist, we would simply open the doors of the jail. In some circumstances, we could Baker Act them from the jail, but that was unsuccessful in most circumstances as well, so they would be released. If they were then picked up in any period of time during that open case, so within the next year, the judge at the first appearance hearing, and that hearing 24 hours within being arrested, would be advised that that individual was incompetent. and then the person would be released again. So you can see how those people quickly went into the cracks.
Let's talk about how the comprehensive treatment court that you initiated, how that plays a role in this process.
Comprehensive treatment court is designed for competent defendants who are seriously mentally ill and cannot meet a basic needs. The reason that exists is because the statutory authority allowing for this mental health court requires a voluntary decision. So obviously, if someone's incompetent, they cannot make a voluntary decision. But when we have seen some of the most sad cases come through the jail, we have made room for them. And they are incompetent, and we have taken them under conditional release rules in the criminal rules of procedure. But these folks are substantially more work, and comprehensive treatment court was not designed nor funded for that purpose. But we are making progress with these individuals, and we are creating a system. I applied this week for a grant in hopes of being able to take more folks who fall into this category. But unless there is going to be treatment available, we simply have to let them out.
Well, part of the clinical psychologist's role here is being able to communicate with these people. What are some of the ways that you've learned, Dr. Renier, to talk to these people, to try to understand what's going on inside their heads?
One of the ways we use is to not challenge delusions or strange belief or extreme beliefs. And frequently when someone hears a discussion about Martians living in their attic, a person who's not trained says, well, that can't be. And of course, then the recipient gets angry. What we're good at is having patience. We listen to the story about the Martians and we say, how terrible it is to live with a Martian in your attic. That's terrorizing every day, how terrible it is. Once you do that, they begin to establish some sense that you're safe and that you can communicate with them. And suddenly the veils drop and they begin to talk about other things. It's amazing how many people want to challenge a crazy person who has some crazy extreme belief and wants to challenge the crazy belief, and then they're surprised when they're attacked. We know not to do this, and that's one way. Another way, luckily for us, when someone's locked up and taken away from a bad situation and they've had time to sleep and get some rest, sometimes just that makes them more communicative. So we have our own techniques, and sometimes just time helps them to improve a little bit, just enough so that we can get the pertinent information out of them.
Do the medications really help?
Well, they do. But at the jail level, sometimes the patient doesn't want medication. They see the medication as something evil. Some will take it, some won't take it. As I said earlier, it sometimes takes weeks for medication to take effect. And in the weeks you're waiting, the person can be quite dangerous. So hopefully when a patient is picked up housed in the county jail, they will respond and take medication. But it may take days, a week before the jail psychiatrists even hear that they're in the jail to come down and see them and offer them medication. So it's a complex situation.
Well, we talked about the involuntary hospitalization that is part of the Baker Act process, where they keep them maybe 2 or 3 days and then release them, and then the FACT team gets involved. What is a FACT team, and what are they supposed to be doing?
Well, the FACT team doesn't get involved that early. It's sort of it's at the disposition phase that the FACT team get involved. The FACT team, the idea of it was that we have some patients that we release from the jail, and they have nowhere to go. They don't have a home, or the family doesn't want them back because the family is relieved that they're gone. That now the family can be normal without them. And so if without services, they would instantly go back to being psychotic. They have no way of getting medications, no way of getting to their appointments. And so the FACT team was created as a system, a conduit that would, when that patient is placed in their care, they would make sure that patient gets to a doctor to keep their medications going, get to their therapy appointments, find housing when that happens, talk to relatives who would then take them back, particularly if the relatives know there are support systems, they're more willing to accept a member of the family who is disturbed. And so they fill in all the missing gaps. They will help the person apply for disability or insurance that often will pay for the health care and the mental health services they need. So this is a very crucial service. The problem with it, and we didn't anticipate that at first, is that they have a capacity for about 100 patients. They may have 1,000 to care for. And once they take a patient in, it's a lifetime. And that's the problem with the system.
Let's talk about some of the things that we try to do to help these folks out. And Judge Quartermain, you told me about a process referred to as intensive case management. And Dr. Renier, you talked to me also about what a professional friend is. Tell me about what that concept involves.
Well, let's say someone suffers from schizophrenia and they have no social skills. They have no ability to make friends. And so they're isolated. And a person who's isolated, by that very nature of isolation, causes mental disorder. Isolation does. And so they're not going to be able to make friends on their own. Having a professional friend, someone who will accept them no matter how they arrive in the office, smelly, disheveled, unkempt, that person will talk to them. That person can talk to them about resources in the community, connect them to those resources in the community, listen to their stories about Martians in the attic or in their brain. That person becomes invaluable and takes the person out of their isolation and nightmare into a social situation where they can communicate. Communication, just by itself, relieves so much suffering. If you have someone who can share with you that you hurt and that you're alone and relieve the loneliness and communicate with you, that itself is priceless.
How would you say having a social network plays a role in trying to get these folks stabilized? How important is that?
It's the difference between succeeding in treating a mentally ill person and failing to treat a mentally ill person. We know from a sound scientific basis that the happiest people are people who have the best social network. The person who has friends, the person who has professionals in their lives, the person who has a job, the person who's connected socially. And we also know people who don't have those things are the most unhappy. And so connecting someone socially, having friends, having a place to go for entertainment, having a job to do, gives self-worth. And we know that if we give that patient those resources, those things alone are going to keep them out of hospitals, are going to keep their mental disorder under control if we can get them to do it.
Well, Judge Quartermain has mentioned about how important community resources are in establishing that social network where folks can have a contribution to make, a stability in their lives, a normalcy, a routine. And that's exactly where Scott Eller comes in with his organization. Scott, tell us about Castle and what your mission is and what you try to do with these folks.
Well, he sort of described what our secret is. One of the misconceptions of mental health is people think it's a lot of money for treatment and medication. And while you do need medication and you do need treatment, typically when you get somebody stabilized, from our experience, we are seeing a psychiatrist about 15 to 30 minutes per month at the most, and basically we go there to get the scripts. But we have people involved in their lives, like you pointed out, that are like a professional friend. And these people that they see either every week or even every day, and sometimes 3 times a day. And by doing something that simple and helping people, live life, we're seeing a dramatic reduction in the acute care system. There was a study done in Lee County called Take a Look at Homelessness back in 2007. And they did some research on folks that were living on park benches and in woods. And by taking their date of birth and social security number names, they were able to pull their insurance information or the billing to the county hospitals, and they were averaging $87,000 a year in acute care services. People living in housing without the supports, without the professional friend, were consuming $52,000 a year in acute care services. So just by providing housing alone, there was obviously a dramatic reduction. They took people in our Castle program, and they were averaging $5,000 per year in acute care services. So you're seeing a tremendous decrease in acute care services and instability just by simply not only incorporating the housing, but the professional friend, or what we call supported living services.
Let's talk about how the cost compares to keeping them in jail versus releasing them into the community into one of your programs. What's the cost differential, if you know?
Well, I spoke to Judge Leifman down in Miami-Dade, and the Miami-Dade jail is the largest housing program in the state. They serve 1,200 people per day in the top 2 floors of the jail because they have nowhere else to go. And the estimate is $120 per person per day to keep them in a jail. To keep somebody even in our 24/7 operation, which is our assisted living program, that's about $60 to $65 per day. And sustaining people in supportive living is between $20 to $30 per day. And that's everything included.
What are the different levels that you're able to provide? I mean, you mentioned several different types of facilities. I know you run Resurrection House, right?
Renaissance Manor.
Renaissance Manor, I'm
Yes,
sorry,
sir.
in Sarasota. Tell me about Renaissance Manor, how that works.
Well, Renaissance Manor is the county's only licensed assisted living facility with a limited mental health license. We have 38 licensed beds there, and then we purchased a couple homes behind it where we have, like a step-down unit or supportive housing, but they can still access the services at the ALF if needed at a moment's notice. And within the ALF, it's staffed 24 hours a day, 7 days a week. We have, during the daytime hours, on-site case managers. We, around the clock, have psych techs that could also supervise self-administration medication. We have housekeeping. We provide their meals to them, and we provide all the transportation. We schedule their doctor's appointments. We take them to the doctor's appointments, and we make sure that they properly represent their symptoms or challenges with the doctor when they're at the appointment.
So how do you recruit the people that work for you? How do you get the right people in to work these programs? Do you actually do the recruiting yourself?
I used to, but since then we have hired an HR director, and we go through a lot of resumes because it takes a unique type of individual. In typical healthcare and assisted living facilities, it's more custodial care. We're helping people with grooming and bathing or even eating. In our facility, it's more of helping people live. They can groom themselves and bathe themselves. They might need to be reminded. They might need some coaching. But our program is not as much custodial care, like I said, as Dr. Renier pointed out. It's more of having that professional friend or that life friend. And so we're more involved on coaching them and helping them live life and get to the next step.
Where do you get your funding? How do you get money to run these programs?
We have to blend it through multiple sources. The state of Florida only reimburses us at $34 per bed per day. So we have to utilize various state contracts and also contracts with Sarasota County government, helps supplement the bed cost. And then on top of that, we do have a donor base that does help make up the difference.
So, Judge Quartermain, let's take an example of a particular person. I don't want you to use the name, but I know you've had dealings with a particular individual who had a number of violations. You would look at this person's record and say, this guy's hopeless. There's no way he can change. Tell us about this person and what happened to him and how you dealt with it.
Well, gosh, I've got several people that fall into that category, but I had a gentleman who, if you were to have looked at his criminal record, it was scary. He had a lot of sexual exposure type cases. That wasn't a battery on someone else, but exposure cases. He had a lot of homeless type crimes that we had talked about before. He had been living in a tent outside for years, and he had been deemed incompetent. So I want to say he might have had 60 or 70 criminal convictions. I mean, it was a lot. And I'm going from memory now, and we have a lot of them, but it was a lot. It was up there. And I was successfully able to, with him, and this is probably one of about 3 I've been successful with, to Baker Act him. And he was involuntarily committed to the state hospital through the Baker Act facility. And then he was there for some period of time, and he went to the FACT team, as Dr. Renier was talking about. Through the FACT team, he went to live at Castle. And I am thrilled to report that he has not picked up any criminal charges in at least 6 months. He interviewed with the news to discuss his journey, although I don't really think he understands how his journey began, and that it began with the Baker Act. He only remembers coming back from the state hospital and going into Castle, but he was, to talk to him, he was an intelligent man, to hear what he had to say, to talk about how thankful he was to be at Castle. And he has been described as the model participant. And he was someone who society threw away. And if people like Scott and Dr. Renier, who write the reports, and the court don't step in and stop it is insanity to let this person continue to spiral down, and his future would have been to die on the street or to then go to the next step, to become dangerous to someone else. But, now he is living stably and being monitored through the FACT team.
Well, I don't have to mention his name because, Scott, I know you know who she's referring
Yes,
to.
I do.
Pick up the story at your end. What did you do different, or what did you provide in the way of services for this individual?
Well, it's sort of interesting how it started. My assistant administrator at the facility called me and she says, we just got this referral and this guy has a rather interesting resume of arrest. And I said, okay. And she says, I don't think we can take him. And it was around that time that Judge Quartermain reached out to me and suggested that I, rethink it. And with that, I did. And, because we never want to make judges mad. But in all seriousness, I said to our team, I said, well, have we seen this guy? Have we met him? And they said, no. I'm like, well, take the day off, drive down to Miami, and go meet him. Let me know what you think. Because if there's anything I know about the people that work for me, and work with me is what I should say, is you can read a paper or a history of somebody and it could easily say no. But when you get in front of them, it's not so easy to do that. And I knew when they went down there, they were going to come back with them. And that's exactly what happened, because they got down there and they met this gentleman. And they said, Scott, there's something there. I think we can do this. So I know you could do it. He's been with us since February of 2017. We haven't had a problem. He takes his meds. We'd have to remind him to bathe, and we've had to help him with some grooming things. But since then, he's taken a lead on it, and he's now asking to start going to the Vincent Academy. So that's going to be our next step to where he can learn employment skills.
Let's talk about Vincent Academy. Do you know about that?
I do. I think that Mr. Eller would be better to describe the program specifics, but I want to say that it is going to provide opportunities for people who are very vulnerable and suffer from mental illness, and give them a lot more meaning, or the potential for a lot more meaning in their lives. And I want to just follow up with what Scott was saying, and that is that it's hard to take a chance on people, and it's hard to ask when someone has a hard, the resume he referred to, I haven't heard it called a resume before, but when someone looks like that on paper, and it's hard to say, okay, I'm going to give this person a try, because if they fail, it does make it more difficult to stick your neck out the next time. But we cannot live in a world of fear, because it will lead to what we have today, which is excuses to do nothing and a burgeoning problem with no resources.
So, Scott, what do you know about Vincent Academy? It's a new program, apparently, here in Sarasota.
Well, I'm one of their ambassadors, and I was there for a lunch today, and just so everybody knows, we are, I believe, on November 9th, we're going to have the grand opening. They've been operating since June. They now have 32 members, so they've exceeded their original expectation by number of people and by the time frame for which they gave to do it. But the Vincent Academy is there, and I got a little card here. It says training, skill development builds a better future. Work, gainful employment transforms lives. And community mutual acceptance fosters growth. Their concept is they're going to bring people in, and they're going to teach them independent living skills. They're going to teach them skills as far as multimedia, how to use computers and certain software like QuickBooks, and Microsoft Word and Excel. They're going to learn culinary arts. They even have a graphics design studio where they make their own business cards and their own menus and their own placemats. But they could do so much more. And I was there today and I saw the ability and the artistic ability that the folks have. I'm like, you guys have a business here. And if you went there and had the food, it's a 5-star restaurant. So the idea is once they get people with the skills building that they could provide there, they're then going to integrate them into jobs into the community. And it goes back to what we're saying here. Mental health, we need to get away from the stereotypical mindset to where people need to be in a hospital or institution. No, people need to have support. They need a self-confidence, and let's integrate them into the community, into society. But let's give them the skill set to do it. And even at Vincent Academy, when they help you get a job, Vincent Academy is going to own that job. So when you go to that job for training, it's a Vincent Academy staff person that's going to be there with you, the professional friend, right? The professional friend's going to be there with you, and they're going to train you in the job. So when you go to a job and you have paranoid schizophrenia, it's going to be a lot easier to learn that job when you know the person that's training you, because you knew them from the Vincent Academy. And that's the success of it. They're realizing we're breaking the mold, we're breaking down barriers and ideas of mental health. We've gone beyond the treatment aspect, which is vital. And I can't stress that enough. As a matter of fact, I'm still championing bills in Tallahassee to create more capacity in our communities because there is a deficit. Okay, but the skills building, the teaching people how to live, working with our program to do it, is the key to success.
I think what you're saying too, which is, we've been referencing it obliquely, but this is our community's problem. It's not the state government's problem. Each local community has a responsibility to develop the resources that are necessary to address these, as opposed to people just complaining, well, there's these homeless people sleeping on the streets, et cetera. We need to concentrate our resources, get our legislators' attention, that these are the type of programs that can work and do work, and they're cheaper than incarceration, and it's safer for the public. Dr. Rainier, you see the value of these things like Vincent Academy, right?
Well, Judge, you're so right. It's not just cheaper than incarceration, it's significantly cheaper than incarceration. And being a Christian, I think we owe our citizens, all our citizens, a right to a life, even those who are sick. And mental illness is an illness. It's not something you invite on yourself willingly and voluntarily. It's an illness. And we owe it to those who are sick among us that they at least get minimum care. And to ignore them and to jeer at them in the street and to want them only to be locked up and nothing more, to me, a civilized society doesn't do that.
Well, we've been struggling for years with the homeless problem. And it's not just providing housing for them. It's really trying to get into what the root causes are and trying to address interventions that we have talked about here that can help stabilize them and get them into a decent life. There may be some who are hopeless, frankly, and we have to accept that fact. But there's a legal parameter here that's involved too, right? I mean, these people have civil rights. What have the courts said generally, Judge Quartermain, about the rights of these folks?
What have the courts said about the rights of these folks? Well, in the case of the city of Miami versus Pottinger, the federal court, the Southern District, held that you cannot incarcerate or charge, even give a citation to an individual for doing something that is consistent and necessary with being a human being, like sleeping. So an ordinance, for example, that prohibits lodging or camping in the city limits means you can't basically set up and sleep, your place on the sidewalk. Well, until law enforcement is assured that a shelter or a viable option for that person to go is offered to that person, and that person declines and continues to engage in what is a crime, as our city, county, and even the state statutes provide for, and to some extent, then it is at that point they can be incarcerated. And we have to understand one of the things that is so important is that all of these individuals are, someone's child, and they all come with their own unique set of circumstances. There is no one-size-fits-all approach. And there are some homeless people, and homelessness is a complex issue. It is, like I said, not a one-size-fits-all approach. But there is a faction of those folks who are homeless who are truly not desiring to live by society's laws and are doing so conscientiously and competently. They simply will not follow the law after being given opportunities to do so. And then there are the other factions, which are people who are truly sympathetic. So you cannot enforce the rules in a harsh way by incarcerating someone until you know where they fall and until you have provided those resources.
We've also tried warehousing these people. Dr. Renier, you've been around long enough as I have. You remember the old days when we used to send them out to G. Pierce Wood, which is a facility in Arcadia. Did you ever have occasion to go out there?
I sure did. Those were known as the glory days, where we didn't have homeless people in our streets. They all live in a state hospital, who were pastorally designed. They were sort of peaceful to go to those areas and see them. They were enormously expensive to maintain. We have learned over time that we can do the same thing, give them a better quality of life locally in a community when there are resources. Our problem is that we've let the resources all decline to such a degree that there's very little left. And we're having a problem with them because there are no resources. If we had those resources, we could actually give people much better lives.
Do you recall what happened to G. Pierce Wood?
Well, after the Mental Health Act was passed, it was a federal mandate that all patients in state hospitals who lived on those facilities would be moved into the communities, and the communities would have mental health centers, community mental health centers, and they would be funded appropriately to provide the professional friend, the housing, the psychiatry, the things that we needed. It would have been a cheaper way to manage them. The problem with the Mental Health Act, it was a great in theory, it was never funded. And so they closed down the hospitals because that was where the money was going out. They closed down the mental hospitals, kicked out on mental patients, and they had nothing for them to go to. And we've been struggling ever since.
I remember when they released the inmates out of G. Pierce Wood, we had several of them come back here, and there were some very unhappy incidences because the system was not in place. I recall an incident where one of them, mentally ill folks, was on Ringling Boulevard. A police officer walking the beat saw this person, he pulled a knife, and the cop shot him. And, it's one of those things where he was being protected in the G. Pierce Wood environment. Outside, we didn't do the support and the things necessary to protect both the public and this person. And so we've had a number of those incidences that we really haven't coped with the problems of releasing these people from the warehouses, which of course the court said we can't keep anyway. But the goal here is humane treatment and trying to find the sweet spot where we can take care of them, protect the public, also treat them with dignity. It's a difficult thing for our society to do.
You know, Judge, the thing that is often overlooked is that the mentally ill can have normal, happy, productive lives. Just like someone with diabetes, someone with cancer, someone with any other health issue, if they're given the right medical care, medical treatment. Our society, we don't even understand how to conceptualize the mentally ill. We don't even know how to cover them with insurance. And so until we have a societal discussion and define what is mental illness and have resources for them, we're going to continue struggling with this. And the people who could live normal lives will not live that normal life. The idea that some of them are extreme, they are unrecoverable, it's only a very small minority that are so. Most of them can have normal life, productive lives, if they have the resources. If you took insulin away from people, we'd have massive deaths of all these. If you didn't give treatment to cancer, we'd have massive deaths all over the place. Well, imagine that happening to the mentally ill who don't have resources, and we have massive loss of life because of it.
Scott, I'm going to give you a soapbox here to stand on. And,
Are you sure you want to do that?
Yeah. Give us a wish list. You say you're going to the legislature.
Yes, I am.
What's your goal? What is your purpose in going up there and trying to convince them?
Well, there's a few things. People talk we're 49th in the country, and I say we should be 49th in the country because we shouldn't be first either, because that tells me there's some inefficiencies in it. And you mentioned something that really stuck with me. You said the sweet spot. And we need to obviously go from, for example, 49th hopefully to 15th or 10th place with funding, but we need to look at non-traditional sources, okay? I've told people repeatedly, I cannot put a key in the door and open a house up for people to move into if I do not have access to robust and ample outpatient services. And I'm talking about where we don't wait in a waiting room with a mentally ill person that we just got out of the woods for 3 hours. We have to get them in and get seen by a psychiatrist and start the process. So I think we need to look at our mental health system and do two things. We need to redesign the funding, and we need to redesign the mental health system. We cannot rely on one provider in a county. We need some choice like we do in the medical community. For some reason, in the medical community, if you need a cardiologist, there's 100 from in town to choose from, for example. But with mental health, there's one. I think that's problematic. The other issue is the FACT team has been a model that's been around for 40 years. Or we say we cannot design a new model. That's really what Castle has done with agencies such as First Step and Centerstone and Coastal. So we have found ways for dollars to go further. For example, the state was running group homes like mine. The state was doing it for around $200 per bed per day, but I'm doing it for $65. The state was having to bake rate 20 to 40% of the people annually. We're bake rating less than 5%. So I think we need to look at an innovative approach. The other concern that I have, Florida is the 5th largest taxpayer in the United States of America in federal income taxes, yet we're 38th in funding per capita wise on Medicaid. Well, that doesn't make any sense to me. And the other problem I have is Medicaid is an antiquated reimbursement system where there is no methodology or formulary as to how they come up with reimbursements, and also to get reimbursed is a nightmare. For 3 people at my assisted living facility, I'm just now getting paid for services from September of 2016. So that's problematic. I think we need to look at the managing entity model, like Central Florida Behavioral Health Network has, or Jacksonville has or Lutheran Services has in Jacksonville, Florida. They fund over double the services that Medicaid funds as far as reimbursement. Central Florida is funding Renaissance Man, or Central Florida is funding Vincent Academy. They're looking for ways to go into communities and to innovate in their funding. And before long, Central Florida is going to be funding Comprehensive Treatment Court if I have anything to do with it, as well as shifts. They've dabbled into shifts, and they're going to be doing more funding for our shifts program that I'm running with the Sheriff's Department.
Talk about shifts, because I'm not sure our audience knows about shifts.
Shifts is Sheriff's Housing Initiative Facilitating Transit Services. It was designed by Wayne Appleby at Sarasota County Government, who has done an amazing job himself in innovating new programs. In 18 months, we took 111 people out of homeless encampments and off the streets, and we put them into housing. In the 18 months before being in our program, the 111 people, 99 had a diagnosed mental illness, 93 received services. Here's the more frightening statistic. There were 667 arrests and 875 charges in the 18 months prior to being in the SHIFTS program. In the 18 months post-admission to the SHIFTS program, we had 3 arrests, 0 new charges.
I think what we need to do, too, is to say that we do have support for these initiatives with law enforcement. Our sheriffs and our city chief of police, they're all seeing the value of this. They're working together in partnership with the courts, with the community organizations such as Castle, and working with the mental health communities to see if we can make some improvement over what's happened in the past. So I think we're very fortunate in this area. Also, we're fortunate to have very caring individuals. For example, the Geyer family that helps with the Vincent
Yes.
Academy. We got people who will put resources and give money to help this very unfortunate demographic that we have. Well, folks, I think that's all the time we have today. So these are 3 professionals who are passionate about the humane treatment of the severely mentally ill. They promote and support programs to enhance the potential for troubled individuals to become healthy and productive citizens. There's hope for even the most ill among us. We trust you see there may be solutions to what many see as insoluble. Thank you folks for watching.